Tips and tricks with regards to fluids. Well, I would say, first of all, don't be afraid of fluids. They are your friend, but also they can lead to adverse effects. I think the body as a whole is much better adapted to hypovolemia and the response that occurs secondary to fluid loss than it is to hypervolemia, which is really an iatrogenic problem that the body is not well adapted to. So close monitoring while administering the fluids that you think are indicated is important. It shouldn't be a scary process to administer fluids, but I do think that carefully evaluating the patient's initial presentation in terms of cardiovascular stability and hydration status are important. And then don't forget that you have to repeatedly reevaluate those in an attempt to avoid any adverse effects. Trying to not give too much fluid is probably the most important pearl I could give, but at the same time we want to make sure perfusion is adequate so that the organs don't suffer from oxygen deficits and subsequent injury. So be cautiously judicious in choices of fluids and monitor frequently for any changes or potential complications.